A teacher praises a child only when they sit quietly during group time. Over time, the child sits quietly more often. This is an example of A. Negative punishment. B. Positive reinforcement. C. Extinction. D. Negative reinforcement. Answer B. Adding praise increases the likelihood of sitting quietly, which is positive reinforcement. A client screams to escape a math task, and the task is removed. The screaming increases in the future. This is an example of A. Negative reinforcement. B. Positive punishment. C. Automatic reinforcement. D. Extinction. Answer A. The behavior removed the aversive stimulus, math task, which makes escape more reinforcing. Which is the best example of stimulus control? A. A child claps randomly throughout the day. B. A child raises their hand only when the teacher is present. C. A child eats whenever food is nearby. D. A child cries after bedtime stories. Answer B. Stimulus control occurs when a behavior happens in the presence of a specific cue, like the teacher. A client receives a sticker after every correct response. This schedule is A. Fixed ratio 1, FR1. B. Variable ratio 2, VR2. C. Fixed interval 1 minute, FI1. D. Differential reinforcement of low rates. Answer A. Reinforcement after every correct response equals FR1. Which is the best example of response generalization? A. Child waves to mom but not to teacher. B. Child greets others by waving, saying hi, or nodding. C. Child says dog only when seeing a golden retriever. D. Child learns to brush only their own teeth. Answer B. Response generalization occurs when different responses serve the same function, like greeting in multiple ways. A token economy is most effective when A. Tokens are never exchanged. B. Tokens are exchanged on a predictable schedule. C. Tokens have no backup reinforcers. D. Tokens are delayed indefinitely. Answer B. Tokens must be paired with backup reinforcers on a predictable exchange schedule to maintain value. An RBT observes that a client's aggression increases when the iPad is removed. What should the RBT do first? A. Return the iPad immediately. B. Collect ABC data on aggression. C. Ignore the aggression entirely. D. Use physical restraint. Answer B. ABC data helps identify triggers and consequences to guide the behavior plan. Which situation best illustrates extinction burst? A. Behavior decreases slowly over time. B. Behavior increases briefly before decreasing. C. Behavior disappears instantly. D. Behavior changes to another topography. Answer B. Extinction bursts are temporary increases in behavior before it decreases. An RBT is teaching color identification. The client always answers red regardless of the card shown. This is A. Stimulus generalization. B. Response generalization. C. Overgeneralization. D. Prompt fading. Answer C. Overgeneralization is applying one response too broadly, such as calling every color red. A client learns to tie shoes in therapy but cannot do it at home. This problem is related to A. Maintenance. B. Generalization. C. Extinction. D. Shaping. Answer B. Generalization means transferring learned skills to different settings, people, and stimuli. Differential reinforcement of alternative behavior, DRA, is best used when A. You want to teach a replacement skill. B. You want to punish a behavior. C. You want to ignore all behaviors. D. You want to reinforce random actions. Answer A. DRA reinforces a positive alternative behavior while reducing problem behavior. A session begins with an easy task before presenting a difficult one. This is known as A. Pre-MAC principle. B. High probability request sequence. C. Shaping. D. Chaining. Answer B. High probability requests build momentum by starting with easy tasks. Which is an example of automatic reinforcement? A. A child spins because it feels good. B. A child cries to get candy. C. A child runs to avoid cleanup. D. A child asks for help to open juice. Answer A. Automatic reinforcement occurs without social mediation, like sensory stimulation. The process of reinforcing closer approximations toward a target behavior is A. Shaping. B. Prompt fading. C. Chaining. D. Extinction. Answer A. Shaping builds complex skills step by step by reinforcing successive approximations. Which is an example of backward chaining? A. Teaching a skill from the last step backward. B. Teaching a skill only in the beginning. C. Practicing steps in random order. D. Prompting until independence without sequence. Answer A. Backward chaining starts from the final step so the learner experiences task completion early. Which is the best way for an RBT to maintain client dignity? A. Discuss behaviors openly in front of peers. B. Use respectful language and privacy during care. C. Post data sheets in public spaces. D. Ignore family input entirely. Answer B. Client dignity requires privacy, respect, and professional conduct. If a client independently requests a break, this is an example of A. Manned. B. Tact. C. Intraverbal. D. Echoic. Answer A. Mands are requests controlled by motivation, such as asking for a break. Which best demonstrates a tact? A. Child says ball when seeing a ball. B. Child says please for candy. C. Child says what's your name? D. Child repeats dog after hearing it. Answer A. A tact is labeling things in the environment under control of nonverbal stimuli. A parent tells the RBT to use punishment procedures not listed in the plan. What should the RBT do? A. Follow parent instructions immediately. B. Explain that only written plans can be used. C. Create a new punishment system. D. Ignore the parent. Answer B. RBTs must follow the written treatment plan and consult the BACB, not implement unauthorized procedures. A child tantrums less when a visual schedule is used. This is an example of A. Antecedent intervention. B. Punishment. C. Response generalization. D. Reinforcement thinning. Answer A. Visual schedules change the environment before the behavior occurs, making them antecedent interventions. Which of the following best describes a fixed interval schedule? A. Reinforcement after a set number of responses. B. Reinforcement after the first response following a set time. C. Reinforcement after varying responses. D. Reinforcement randomly with no pattern. Answer B. In FI schedules, reinforcement is available after a fixed amount of time if the behavior occurs. A client is taught to request water using a picture card. Later, the client uses the card independently. This is A. Prompt dependency. B. Functional communication training. C. Overcorrection. D. Differential reinforcement of low rates. Answer B. Functional communication training replaces problem behavior with appropriate communication. Which is an ethical responsibility of an RBT? A. Share client details on social media. B. Only implement procedures under supervision. C. Create independent treatment plans. D. Modify goals without consulting a BCBA. Answer B. RBTs implement only approved plans under supervision, maintaining ethics and client safety. When an RBT is unsure how to run a procedure, the correct step is A. Stop therapy completely. B. Ask the supervising BCBA for clarification. C. Guess based on past clients. D. Make new procedures independently. Answer B. Supervision ensures proper implementation and protects client progress. An RBT notices that reinforcement loses value when given too often. This is called A. Deprivation. B. Satiation. C. Generalization. D. Habituation. Answer B. Satiation happens when a reinforcer is overused and loses effectiveness. Which best describes a discriminative stimulus, SD? A. A signal that reinforcement is available. B. A stimulus that punishes behavior. C. A stimulus that eliminates behavior. D. A random environmental event. Answer A. An SD signals that a specific response will be reinforced. What should an RBT do if a client engages in self-injurious behavior? A. Collect data and follow the behavior plan. B. Create new punishment procedures. C. Ignore safety concerns. D. Remove reinforcers permanently. Answer A. The RBT must follow the written plan and ensure safety by documenting data. A client is taught to wash hands step by step with prompts. This method is A. Task analysis and chaining. B. Shaping only. C. Reinforcement thinning. D. Automatic reinforcement. Answer A. Task analysis breaks skills into steps, and chaining teaches each step systematically. Which is the best example of differential reinforcement of incompatible behavior, DRI? A. Reinforcing sitting instead of standing. B. Reinforcing hand raising instead of shouting. C. Reinforcing drawing instead of reading. D. Reinforcing eating instead of drinking. Answer B. DRI strengthens behaviors that cannot occur at the same time as problem behaviors. A client says cookie after hearing the therapist say cookie. This is A. Intraverbal. B. Manned. C. Echoic. D. Tact. Answer C. Echoic occurs when a verbal response matches exactly what was heard. What is the main risk of using continuous reinforcement for too long? A. The behavior may stop generalizing. B. The behavior becomes resistant to extinction. C. The client will always require prompts. D. The client may show aggression. Answer A. Continuous reinforcement is effective initially, but thinning to intermittent schedules supports generalization. An RBT is teaching social skills by role-playing. This strategy is A. Discrete trial training. B. Natural environment teaching. C. Behavior skills training. D. Errorless learning. Answer: C. Behavior skills training includes instruction, modeling, rehearsal, and feedback. A client consistently avoids math work but participates in reading. What is the most important next step? A. Conduct a preference assessment. B. Collect task demand data. C. Punish math avoidance. D. Reinforce escape behavior. Answer: B. Identifying task demand patterns helps guide intervention for avoidance behaviors. A therapist fades prompts too quickly and the client stops responding. This is called A. Overgeneralization. B. Prompt dependency. C. Ratio strain. D. Prompt fading error. Answer: D. Removing prompts too quickly can cause errors. Fading must be gradual and systematic. Which is the best example of a conditioned reinforcer? A. Money. B. Food. C. Water. D. Sleep. Answer: A. Money gains value through learning and pairing with primary reinforcers, making it conditioned. A client screams when denied a toy, and the RBT ignores it consistently. Over time, screaming decreases. This is A. Extinction. B. Punishment. C. Shaping. D. DRO. Answer: A. Extinction occurs when reinforcement is withheld, reducing the behavior over time. What is the most ethical action if a client shows new dangerous behavior? A. Report immediately to the supervisor. B. Create a new plan independently. C. Ignore unless parent complains. D. Post the behavior on social media. Answer: A. RBTs must report dangerous changes immediately to their BCBA to ensure safety. A client independently transitions between activities after visual prompts are faded. This demonstrates A. Prompt dependency. B. Independence and generalization. C. Punishment. D. Extinction burst. Answer: B. Independence and generalization occur when skills transfer without prompts. Which is the best example of a variable ratio schedule? A. Reinforcement after every fifth response. B. Reinforcement after an average of 5 responses. C. Reinforcement after 5 minutes. D. Reinforcement after the first response in a fixed time. Answer: B. In VR, reinforcement occurs after an average number of responses, creating steady behavior. An RBT wants to strengthen independent play. The best approach is A. Reinforce intervals of independent play gradually. B. Give toys only when the child cries. C. Remove playtime completely. D. Only reinforce when peers are present. Answer: A. Reinforcing small intervals and gradually increasing builds sustained independent play.